Good morning, I'm Francesca, and I'm so thrilled to have you join me and a few of my colleagues this week. We're going to take you behind the scenes of our clinical experiences around the Mount Sinai Health System and give you a little insight to the pulse of the city and things we love to do. Right now, I'm headed to my internal medicine rotation, and I'm about to hop on that shuttle bus to one of Mount Sinai's affiliates in Queens, the Elmhurst Hospital Center. I'll meet you over there. Hello again, and welcome to Queens, one of the most ethnically diverse and culturally rich boroughs in New York City. And we're right at the heart of it all. The clinical rotation at Elmhurst is an experience like no other, and I mean that. You're really going to see the patient population that we serve and understand their 360. From the variety of languages they speak to the religions they practice, whether first-generation immigrants or lifelong residents, you're going to gain invaluable experience in providing care to individuals with unique health needs and perspectives. Now, while I can't show you my actual patient interactions, I will tell you that my day usually goes something like this. I chart check my patients and review the labs in the mornings to see if any significant events happened overnight. And then I meet my patients. I usually have a few during the day. Then the team rounds to run through our patient lists and talk about their medical plans throughout the day and see if we have any potential discharges. Now, after hours, I love food, dance, and dessert, and you can typically find me enjoying a performance on Broadway or at Lincoln Center, grabbing a dessert at one of my favorites uptown, and walking around Central Park to get grounded in nature and listen to one of my favorite podcasts. It's so important for me to take time after a long day to connect with myself and find ways to keep my passions and identities alive.
Hi, I'm Rachel. Now I'm going to let you in on a well-known secret. At Sinai, in many ways, third year can be a choose-your-own-adventure kind of experience. At least that's how me and my friends describe it. You'll find that you'll be able to use your free time to advance your education as you see fit. For some, that could be research or reading scholarly articles. For me, it's research and scrubbing extra cases with the transplant team. I've had the pleasure to meet some of the kindest and welcoming surgeons here at Sinai who have extended open invites to their ORs whenever I have the time, so I take full advantage of that. What excites me about transplant is being involved in patient cases that are both medically and surgically complex, so they require a lot of teamwork. From a surgical standpoint, there will also always be cases that are challenging, so it keeps you on your toes. I also surprised myself when I realized that I liked the bigger open cases, and I guess it lines up with the go big or go home mentality that I tend to have. There's also an opportunity to have longer-term relationships with your patients than many other surgical specialties allow, which is particularly important to me. All the patients are incredibly grateful for what you do for them, and that also makes the work easier and the long hours very worth it to me. The patients are incredibly sick when they first go for liver transplant, and it's truly magical to see their physical transformation after getting the new organ. The field is also very new, and there are a lot of research opportunities to expand the field and exciting things coming down the pipeline, like xenografts and work on normothermic perfusion. Now, when I'm not suited up for the OR, I'm usually suited up for rock climbing at a gym right down the block. Climbing is my go-to form of exercise because it challenges my brain and my body, and it reminds me that I can do hard things. And I love that.
Hey, what's up, guys? I'm Zach. Now, technically, I'm on rotation this week with the internal medicine team, and they focus on diagnosing and treating diseases in adults. For me, what's been really fascinating is to see the teamwork and the communication that goes on within the immediate team and the entire hospital network. The way they collaborate with resources is absolutely unparalleled, and you see exactly how the hospital network all connects to bring the best possible care for our patients. But honestly, I'm a real hands-on kind of guy, and so I want to show you something that really gave me some joy. So come and follow me. So this is the Anesthesia Sim Lab. This is a great place to practice your skills for anesthesiology, which has been one of my favorites so far. In fact, this is one of the many sim labs that are available to students to practice your skills across all specialties. When you're on a rotation in general, you're not just sitting on the sidelines, you're actually in action, and I love that. Anesthesiology is another collaborative aspect of medicine, and I was fortunate to work alongside experienced professionals who guided me through inserting IVs, monitoring patient vitals, and making sure that our patients were comfortable and safe throughout the entire surgical process. This all while having access to cutting-edge technology and state-of-the-art equipment, which you'll also get to use. Now, when I'm not on rotation, I'm in Spanish Harlem playing soccer at the gym. My friends and I try to get a match together at least once a week. Sometimes being in a big city, you may feel a bit overwhelmed, but what I really love about Sinai is that we truly are a part of a community. And meeting up with my friends to play soccer reminds me of that.
Well, hello there. I'm Arman.
And I'm Brett.
And we're both on our ambulatory care rotation this week, but at different clinics across the city.
I'll tell you a little bit about the experience, and Arman will share some details about the locations a little bit later on. So today we're on 23rd Street at Mount Sinai Doctors in Chelsea. Mount Sinai Doctors is an extension of the Mount Sinai Health System, and it provides an easy way for our patients to connect with physicians and specialists without having to travel too far from where they live and work. Think of it as bringing healthcare to our patients' front door.
When you're on the ambulatory care rotation, I think the key word is integration. I'm seeing how my classroom knowledge blends with my patient interactions. Now, all the skills that we acquire about humanism in medicine, being an advocate for our patients, it all comes to light here on ambulatory care. Now, on any given day, you may be providing services from vaccinations, screenings, and diagnosing and treating your patients' acute pain and illnesses. That's when you'll really see how the pathways in medicine intersect. My role on the team is to guide the visit in advance of my patients seeing the doctor. I typically ask them to share, what's important for them to discuss with their visit, what I can do to help advocate or to clarify for them, and even ask them if there's anything they may be scared about and need me to bring to light. The long and the short of it is this: you'll develop your skills in humanistic care and create real connections to your patients. So get ready to be immersed. All right, Arman, take it away.
Thanks, Brett. Welcome to Mount Sinai Union Square. We're a few blocks away from Brett's rotation in Chelsea, but this location is part of a recent transformation to expand services and continue providing state-of-the-art care in downtown New York. Union Square is so vibrant, and I love being here. It draws people from multiple neighborhoods all around the downtown area, from the Lower East Side, the Flatiron District, Chelsea, and more. When you're on your ambulatory care rotation in this area, again, the patient population is just so diverse, from person to person and issue to issue. You can treat a 20-something indie rock artist coming in with a tummy ache to a 70-something pizza parlor owner who's dealing with chronic pains and illness, and everything in between. The neighborhood is distinctive and full of character because of the people. They make it that way. Now, since Brett and I are sharing this segment, one thing that we also share is our love for coffee shops. At some point during the day, you'll almost always find med students looking on Instagram or TikTok for a coffee shop with a calming ambiance, good energy, and, of course, free Wi-Fi. Third years on rotation have to learn how to balance coffee, work, life, and studying.
Yeah, and on that note, we actually have the shelf exam coming up soon, so bye for now.
Hi, I'm Abby. Come on in and get ready with me for my night rotation. You've seen so much being on rotation with my colleagues and friends, and yet there's still so much more to explore. Because most hospital admissions happen overnight, night shift is a really great opportunity to take the lead on a new patient intake and really practice all the skills you've learned so far in medical school. I'll tell you this, every day we're exposed to diverse communities, people, and experiences, and unparalleled clinical training. We're mentored alongside experts and trailblazers in their field. We're working with advanced technology, and we're literally in the midst of innovation, from AI to transgender surgery and research. On that note, another amazing part about Sinai is how easy it is to get involved with research as a medical student. In fact, I'm actually working on a project right now with the transgender surgery team. And I have classmates doing cutting-edge research in so many different medical fields, which for me was like a really special part of Sinai. And remember, the school is part of a huge network with hundreds of clinical and academic experiences ready for you to explore in a variety of communities, from Long Island all the way to the Upper East Side and East Harlem at the main hospital, which is where I'm heading now. I hope to see you guys here soon.